Good afternoon, everybody. We'll get started with the webinar. My name is Jennifer Hope, and I am the Director of Marketing here at ARTA. And today I'm going to talk to you a little bit ARTA as well as the ARTA benefit plans and how MNP members are eligible and how you can apply. Just some housekeeping notes. This session is being recorded, so we can post this on our YouTube channel for future viewing. So your microphones and your video have been disabled just to ensure your privacy. So if you have any questions throughout the presentation, please use the Q&A function in Zoom, and I will monitor that Q&A function and I'll answer any questions as they come in, or I'll save some time at the end to answer any questions that you might have. So just to get started, a little bit about ARTA. ARTA was founded in 1963 as a provincial association for retired teachers. However, we've obviously expanded our offering to other groups such as MNP. So we have onboarded different groups that hold the same type of insurance risk as a retired teacher would. So we have our education sector, where our retired educators sort of belong. And we have our public-private sector, where our like-minded individual groups belong. So we have a variety of different professions in our public-private sector. We have nurses, accountants, engineers, doctors. So we cover over 33,000 members, and we cover over 50,000 lives. So the ARTA Benefit Plan is an extremely stable benefits plan. So there is a fee to joining ARTA, and that fee is $50 a year. And if you do get a benefits plan, that's $4.17 added onto your monthly premiums. And with that ARTA membership, not only are you gaining access to our benefit plans, but we also have some really great membership advantages. We host different wellness initiatives throughout the years for our members. So we have a photo contest, we have physical wellness activities, we have movies for our members, different activities to keep our members active and engaged in retirement. We also have a really great discount program, ARTA Perks. So we brought our discount program in-house, and we contacted many different businesses that we thought our members would appreciate getting discounts from. So at ARTA Perks, we have well over 100 different partners that offer our members discounts to different restaurants, different hotels, airport parking, different retail outlets. If you use your ARTA Perks discount card once or twice, your membership will have had paid for itself. We also have a really great scholarship program. We offer 8 scholarships for our members' direct relatives of $5,000. So if you have any children, grandchildren, nieces or nephews that are continuing with post-secondary education, they're able to apply to one of 8 of our scholarships that we award annually. So now I'm going to talk about our benefit plans. So the ARTA Benefit Plan was established in 1995 by a group of retired teachers who wanted to create a benefits plan that was more conducive to retirees' lifestyle. We all know retirees love to travel, so the ARTA Benefit Plan offers some very unique and competitive emergency travel coverage. I say that because we do not have any pre-existing conditions or stability clauses built into our emergency travel coverage. A lot of plans require that you're stable for 90 to I've even seen 365 days. And I will talk about our emergency travel coverage in full detail in a couple slides. We are a not-for-profit organization, so any dollar that comes into ARTA goes back to administrating the plan, back to ensuring that we're offering our members the best benefits possible at the lowest monthly premiums. There's plans out there that will say we'll give you a discount of say 10 to 15% if you apply during this period of time. We don't offer those discounts because we don't have those profit margins built into our monthly premiums because we are a not-for-profit organization. So the ARTA Benefit Plan is a closed benefits plan. Not everybody is eligible to join ARTA because we want to make sure that we maintain the same type of risk profile of our members. So if you are an MNP employee in good standing for at least 2 years, or you have previous tenure from an acquired company, you are eligible to join ARTA. You need to be an ARTA member, so you have to pay that $50 a year. You need to be Canadian resident, covered by your provincial or territorial health insurance plan. We have members throughout the country, so maybe you decide to retire in Alberta or BC, but you want to move to maybe the East Coast or Saskatchewan, wherever it may be. Your ARTA Benefits Plan will follow you there. The only province where the ARTA Benefits Plan does not follow you to is Quebec, because their provincial healthcare plan doesn't work in tandem with the ARTA Benefits Plan. There's no age restriction to joining ARTA. You can join ARTA at any age, and you can stay on the plan until any age. When you are looking at different benefit plans out there, make sure you're looking at the termination ages. There's some plans that will terminate you at the age of 85. Your eligible dependents can join ARTA as well as a surviving spouse. So if you, let's just say you're eligible to join ARTA today and something were to happen to you, your surviving spouse can join ARTA. Or if you decide to join ARTA as the primary cardholder and something were to happen to you, your ARTA benefits will not terminate your surviving spouse. Your surviving spouse can continue on with their ARTA benefits. There's different plans out there that if something happened to the primary cardholder, they will terminate a surviving spouse, whereas ARTA will not do that. So applying to ARTA. So if you know that you are going to be retiring and you know that you are going to be losing your employer-sponsored benefits with MNP rewards, I typically suggest to people get your application in early, 4 to 6 weeks before you're going to be losing your benefits. It's really easy to do. You can do it right online. It's an easy thing to check off your retirement checklist. However, it is really important to apply within 60 days of losing your MNP rewards benefits. Because if you apply outside of that 60-day window, you would need to fill out a medical questionnaire that is administered by our emergency travel insurance partner, Beneva. And depending on your health and your spouse's health, they may not accept you into an emergency travel plan. So just get that application in early. It's really easy to do. You can do it right online. However, we know that not everybody retires at the same time as their spouse. So if your spouse is continuing to work and they are receiving a benefits plan, that's great. You can continue on as a dependent as their you can remain as a dependent under their plan and have their employer pay for your benefits. And if something, but just make sure you apply within that 60-day window of you or your spouse losing those employer-sponsored benefits. And your ARTA benefits are effective on the first day after you or your spouse lose those employer-sponsored benefits. There's no waiting periods. We do not have any lapse in coverage. We want our members to be covered when they need it. Now I'm going to talk about the different plan options that we have available. We have 3 sort of umbrellas of benefit plans, but first I'm going to talk about these 2, which anyone is eligible for. Well, first, our comprehensive plans are available for members who are under the age of 65. These plans were created for our members who are under the age of 65, and they have some higher prescription drug maximums. Because when you do turn 65, you're eligible for a coverage for seniors plan, whatever that is in your province. And that plan is the first payer of prescription drugs, and then ARTA becomes the second payer in prescription drugs. But when you are under the age of 65, you're not eligible for that coverage for seniors plan yet. So these plans have some higher prescription drug maximums. Our build your own plans, these plans were created for members of any age. You can join at any age. If you decide to start with a comprehensive plan, you can move over to a build your own plan very easily. But these plans were sort of built to work directly in tandem with that Alberta coverage for seniors plan. But first, I'm going to talk about our comprehensive plans. So again, comprehensive plans are available for members under the age of 65. We offer 3 different levels of coverage in these plans, core health being the most basic, essential that middle of the road, and enhanced health has the highest maximums of the 3 plans. With all of our benefit plans, we offer single, couple, and family care options, and you're always able to move up in coverage. But once you moved up in coverage, you are locked in for 24 months. So you can start with one of the low plans, and if something were to happen to you and you need more coverage, you can always move to that next level of coverage, but you are locked in for 24 months. And all of the annual maximums are per covered person. So you don't need to share that annual maximum if you do join as a couple or a family. I'm just going to highlight a couple benefits that we do cover under our comprehensive plans, but please note that we cover a long list of different benefits. We would just be here forever and I would bore you to tears if we went through every single benefit, but I just wanted to highlight a few that are covered under these plans. So the overall coverage level for these plans is 100% unless otherwise indicated. So that means that we'll pay out your claim at 100%. The overall annual maximum ranges from $10,000 all the way up to $15,000. So what that means is that is the most that we will pay out in an annual in a calendar year. So maybe you submitted all your prescription drugs, you got a wheelchair, you got private duty nursing, you got a CPAP machine, you got your vision, you got your hearing aids. Rarely does anyone actually meet those overall annual maximums, but these are the annual maximums for these plans. Prescription drug coverage is covered at 80%, ranging from $1,500 all the way up to $5,000 a year. You might not know how much money you've been spending on prescription drugs throughout the year. So what I suggest to people is go visit your pharmacist, ask them for a average of what you've been spending on prescription drugs. Then you can make an educated guess on which plan might work best for you and your family. Paramedical services are covered at 80%, ranging from $750 a year all the way up to $1,500 a year. And our annual maximum is a little bit different from some plans. Ours is an annual combined maximum. So what that means is, for example, if you had essential health, you have $1,000 a year to spread out through those practitioners that you need throughout the year. So massage, chiro, physio, acupuncture. Excuse me, we cover a list of 13 different practitioners. A lot of plans will give you a maximum per practitioner. So 500 for chiro, 500 for acupuncture, 500 for massage, 500 for physio. You might not use all of that annual maximum. So we want our members to use that annual maximum on the practitioner that they need. Typically, our members only use 1.8 practitioner in a calendar year. Diabetic supplies are a little bit different. We offer our members $1,750 a year to use on diabetic supplies. So on those Freestyle Libres or the Lancets that go in the diabetic supply in those sensors. Our comprehensive plans do include our 92-day emergency travel coverage, but I will go into full detail about in a couple slides here. Our comprehensive plans also include some dental care coverage. So 80% coverage for basic, preventative, and minor restorative work. And our enhanced health plan offers 50% coverage in major restorative work, as well as 50% coverage for orthodontic care for any eligible dependents that you have at home. So in summary, our comprehensive plans are available for members who are under the age of 65. They cover a little bit of everything, so extended healthcare, travel, and dental. So our build your own plans. So our build your own plans are available for members of any age. And if you do decide to start with a comprehensive plan, and then our member services team will call you and say, hey, we notice you're turning 65 soon. You now need to move over to a build your own plan. So with our build your own plans, you are required to choose a prescription drug maximum. So you can either choose $1,500 or $2,500 a year. At first glance, sometimes people say, hey, that doesn't look like a lot at first glance. But remember, your seniors plan, when you turn 65, is the first payer in prescription drugs. ARTA becomes the second payer in prescription drug drugs. So that annual maximum does stretch a really long way. We also offer two plans that do not include emergency travel coverage, HealthWise and HealthWise Plus, and two plans that do include emergency travel coverage, Total Health and Ultimate Health. So you can decide whether or not you want emergency travel coverage in a build your own plan. And our HealthWise Plus and our Ultimate Health Plan, these plans offer some higher annual maximum for paramedical services, hearing aids, vision care, and they also offer some coverage for defined lifestyle medications, so hair loss or erectile dysfunction drugs. Weight loss medications used to live in that defined lifestyle medication category, but with their popularity and how many people they have helped, we do cover those drugs with a special authorization, and it's covered under your prescription drug maximum. So again, with our build your own plans, we cover a long list of different benefits. That paramedical services is an annual combined maximum as well. So we cover vision care, hearing aids, CPAP machine, private duty nursing, many different items. But with our build your own plans, our members can kind of choose what they want in a benefits plan. And again, you can be any age if you would like to choose a build your own plan. We also have two other plans that are available for members who live in the greater Edmonton area as well as the Calgary area. We have opened up a pharmacy, ARTA RX, and we have two benefit plans that work in tandem with our pharmacy, Complete Health or HealthWise RX. So if you are within the greater Edmonton area or the Calgary area, you can gain access to these benefit plans. And by choosing these benefit plans, you are sort of committing to using our pharmacy. So any drugs dispensed at the ARTA RX pharmacy will be covered at 100%. And any acute care medication not dispensed at ARTA RX. So for example, if you got strep throat and you weren't able to come into our pharmacy on the weekend or in the evening, you can go to your pharmacy, your local pharmacy, and they will dispense that drug at 80%. However, if you get any maintenance medications not dispensed by ARTA RX and you are on one of these ARTA RX plans, those drugs would be only covered at 50%. So some differences with our ARTA RX plan, the prescription drug maximum is $2,500. Defined lifestyle medications are covered at 80%. Oops. The overall coverage level is 90% versus 80% under our build your own plans. There are some higher annual maximums for paramedical services, hearing aids, accidental dental, orthopedic shoes, and diabetic supplies. And the Complete Health Plan does include our emergency travel coverage, and the HealthWise RX does not include emergency travel coverage. So these are just two more plan options that are available for our members in the Calgary area and Edmonton area. So with our build your own plans and our pharmacy plans, we do not include dental. So you can choose whether you would like to add dental to a plan. So we have three standalone dental care plans, option A, B, or C. Option A being the most comprehensive with 80% coverage for basic, preventative, and minor restorative work, and 50% coverage for any major restorative work. Option B is that middle of the road and does not include major restorative coverage. And option C offers 65% coverage for basic, preventative, and minor restorative work and no coverage for major. So if you decide to join a build your own plan, you can add dental right when you join, or you can add it later on down the road. It's entirely up to you. Sorry, just to go back, our build your own dental plans. These plans also include single, couple, and family care coverage. And with these plans, you're also able to move up in coverage at any time. But once you've moved up in coverage, you are locked in for 24 months. So our benefit plan members also have access to a really great program, Green Shield Health. So Green Shield Health offers our members virtual physician services. So we all know how hard it is to get into our doctor. So you can pick up your phone with Green Shield Health, and a licensed Canadian physician will answer the phone. They can answer any questions that you have about what's going on with your health, and they can ultimately provide you with a prescription. So just a really great way for our members to get into a doctor right away and get their prescription that they need or advice on what for next steps. We also offer virtual health services and counseling. So all of our members receive 5 hours of free counseling as well as 5 hours of free couples counseling with Green Shield Health. So I kind of touched on our emergency travel coverage a little bit, but if you are taking part in one of our plans that includes emergency travel coverage, one of our comprehensive plans, total health, ultimate health, or complete health, you're gaining access to some of the best emergency travel coverage there is in the marketplace. I say that because our plans do not include stability clauses for pre-existing conditions. So, for example, if you have a trip planned and you go visit your doctor and your doctor provides you a new prescription, or maybe there's a change in your health care, but both you and your doctor feel that you're well enough to travel, there's no cause for concern, you can go on your trip. And if something were to happen to you because of that change in healthcare or because of that change in medication, you would be covered for it because it would be considered sudden and unforeseen. A lot of plans say that you need to be covered, you need to be stable from a change in medication or a change in your healthcare for 90 to I've even seen 365 days. So when you are comparing different plans, make sure you are looking at those stability clauses for pre-existing conditions. You are covered, and if you do go visit your doctor or you fall ill, and you don't feel comfortable to travel, a really great program with ARTA Emergency Travel Coverage is we offer trip cancellation and interruption insurance. All of our covered members receive $10,000 per trip per incident. So maybe you fall ill prior to your trip, or your travel partner falls ill, or maybe your home suffers a flood or a fire. You can cancel your trip with that $10,000. If something were to happen to you because of that, if something were to happen to you because while you are away, you are covered for 100% of eligible expenses up to $5 million per trip. Nobody has ever come close to meeting that $5 million, so you have more than enough maximum to help you get you through something that happens to you while you are away. So you are covered for any 92-day trips you take outside of your province of residence. We know a lot of our members like to travel for longer than 92 days. That's great. You can do that. That's why we offer supplemental travel coverage in 15-day increments all the way up to 212 days. And any unused 15-day increment, you would be reimbursed for that. It's always better to have that supplemental travel coverage before you go away. However, if you're on a beach in Mexico and you're not ready to come home and you haven't made a claim, you're on day 91, you can call ARTA and ARTA can add that supplemental travel coverage if you need it. There is a fee to supplemental travel coverage. So what some of our members do is if they are, maybe in Vegas or Palm Springs, they hop on a cheap flight back to their province of residence, hold on to proof that both covered members cross back into their province of residence with a Starbucks receipt or your boarding passes. And they hop on a cheap flight back to the sunshine and enjoy another 92 days. That 92 days is an immediate reset. You're not required to be within your province of residence for a certain period of time. So I just gave you a lot of information about benefit plans. We have a really great website, artabenefits.net. And artabenefits.net, we have a build your benefit plan tool. And with that build your benefit plan tool, this tool will ask you a series of questions. Are you over 65? Are you under 65? Do you want dental? Do you want travel? Do you want ARTA RX? And from the questions that you answered, a chart will populate with all of the plans available to you, as well as those monthly premiums. I know people are always curious about monthly premiums. How much is it going to cost me? There's so many different plans that you can choose from, whether you're a single, couple, family, if you want a comprehensive plan, if you want to build your plan, if you want dental. So you can find the rate sheets right on our website. And this group will look at the MNP rate sheet, which the province that you belong to. So MNP does have a landing page. So you can visit the MNP landing page on artabenefits.net, and all of the rate sheets will be available right on that page for you. Also on artabenefits.net, you can ultimately apply right online here. It's very easy to do. So that's kind of all I had for you today. I'll stick around and answer any questions that come in the Q&A box. However, if you would like us to send you an enrollment kit, you can email join@arta.net and we'll get one out to the mail to you, or we'll email you one. So just email join@arta.net, or if you have any questions later on down the road, you can always email us as well. I'm going to head to the Q&A section and see if there are any questions that have come in. Oh, there is a question. Is the core, essential, or enhanced health coverage the same thing as complete or total or ultimate? I'm a little confused. Okay, here, let me try to get back to that slide for you. It's got a ways to go. So our core, essential, and enhanced health plans, these plans are available for members who are under the age of 65. So if you are over the age of 65, you cannot join these plans. So if you are under the age of 65, you can join one of these plans. And these plans have some higher prescription drug maximum. They include emergency travel coverage as well as some dental. And our build your own plans, these plans are built for members of these plans are available for members of any age. So you may or may not want to join a build your own plan, or you may or may not want to join a comprehensive plan. It's totally up to you. Oh, there is a question that somebody is almost turning the age of 65. You can join a comprehensive plan. That's entirely up to you. However, when you do turn 65, you will need to move over to a build your own plan. So if you don't want to keep changing your plans, you can join a build your own plan right away. So that total health or ultimate health or health-wise or health-wise plus. Does eligible dependent include post-secondary students to a certain age? So if you have any eligible dependents, so if you have any kids that are in post-secondary education, they can stay on the plan until they're the age of 25, as long as they're in post-secondary, a post-secondary institute. So age 25. So there is some questions about the ARTA RX pharmacy. So we have a physical pharmacy in Edmonton. The Edmonton pharmacy is on 156 and 137th, so sort of northwest of the city. And the Calgary pharmacy is located just off of Deerfoot Trail in the northeast of the city. And if you do decide to join one of those plans and you are within the greater Edmonton area or the Calgary area, you are eligible to join an ARTA RX pharmacy plan. Sorry, let me go back to that slide so you can see it. So there definitely are some benefits to joining an ARTA RX plan, but you just need to be within that we call it the pharmacy service zone. And that pharmacy service zone was determined by the Alberta College of Pharmacists. So we do have free delivery with both of our pharmacies. However, you will need to come in for some in-person care before delivery is provided to you. We have some really great pharmacists. There are some definite bonuses of joining an ARTA RX plan. And we hope in the future that the ARTA RX plans will be available to all members. I guess it's just asking me to walk you through the details again. So any drug that is dispensed by the ARTA RX pharmacy is covered at 100%. However, if you get any maintenance medications not dispensed by ARTA RX, those maintenance medications would only be covered at 50%. If you email join@arta.net, I can provide you more information on those pharmacy plans. There is a question. It looks like individual plans are double the plan for spouses. If both spouses are eligible for ARTA, do you recommend each spouse applying separately, even though the benefits extend to surviving spouses? You don't need to join separately. You can just join as a couple plan. You each receive those annual maximums. You don't need to share them. Each covered person gets the same benefits. Oh, what happens if MNP retiree doesn't turn 65 for 10 years, but spouse turns 65 in a couple years? We base our plan eligibility under the primary card holder. So if you're 50, you can join a comprehensive plan for 15 years, even if your spouse is 70 years old. We look at the primary card holder's age, not the spouse's. I don't see any other questions coming up. But if you do, but again, if you would like us to send you an enrollment kit, sorry, there's so many slides I have to get through. You can email join@arta.net and we'd be happy to send you more information. Or if you have any questions, also, if you are in the Edmonton area or the Calgary area, you can visit our office at any time. You can walk in between 8:30 and 4, I guess not any time. You can come in between 8:30 and 4 p.m. and you can sit down with one of our member services team members and they can walk you through all the plans that are available to you and they can also help you apply. So if you're in the Edmonton area, you can come and visit us. Or if you're not in the Edmonton area, you can also create a virtual appointment. And one of our member services team members will meet with you virtually. And you can always email info@arta.net or call. There's many different ways for you to get your questions answered with ARTA. Also, I'd like to note that this presentation will be posted on the ARTA channel, and I will share that with my contact at MNP. So you can always visit YouTube, search the ARTA channel, and you can go watch this presentation if you'd like to again. But other than that, I've got nothing else for you guys. So I hope you have a wonderful afternoon, and thank you for joining this webinar today.